Hello, my name is Cătălina NECULAU, and I worked as a nurse for 25 years. Now I am teaching psychology and sociology to a post-secondary school for future nurses. So I'm interested in developing the professional identity for the future nurses. So I would present today what I call preferred realities in the construction of professional identity for nurses in training. First, I would say something about social reality, social construction of reality. Antonio Sandra and Elena Unguru identified two theories sustaining the social construction of reality. One of them is a sociological perspective, which is saying that reality is already constructed before being interiorized, being a guide which coordinates individuals' life by making sense of it. And the other one is the psychosocial perspective coming from Payne's work, which is focused on concepts like identity, personality, and perception in the psychological sense of social constructivism. The social constructionist paradigm does not recognize a stable, fixed personality, considering it a social construct. Ruskin is seeing in this approach the correspondent of the self used by Carl Rogers as identity, which is building from the way that the others are talking about a person, from the way that person is identified and treated, all of this depending on specific social contexts. And if we are bringing this idea into the working area, so we can say what people are talking about the other person can be in relation to her professional behavior. So the first experiences might get great importance in the start of building professional identity, considering the need for validation and consolidation that a beginner needs at the start of his career. The medical area is closely linked to high moral standards, and that can make what others are talking about someone more important for the nursing students in their first experience in the practical training. The identities get sense for a person through social interaction, and the nurse identity makes sense in relation to the doctor's identity. So the other one's answer to the role identity is the base for developing the sense of self-meaning and self-defining. Professional identity can be viewed from a personal and an interpersonal perspective. Professional identity is integrated in the personal identity of the nurse, and that's the way a person feels by being a nurse, which is subjective, and the image of the others have about the person as a nurse, which is considered to be objective. And also psychological factors like self-esteem and sociological factors. Congruence between feelings and behaviors for the others, fulfilling the duties coming from the social role, sharing experiences through narratives, and reflection with other nurses. Identity is born in the process of socialization, growing up of the nurse during the interpersonal relationships, being sustained by self-reflection. A small comment on the definition of narration and story. Narration, it means the act of giving an account describing incidents or a course of events, while story is a piece of fiction that narrates a chain of related events. So we have that piece of fiction in class. Todd and Fisher and Reisman were saying about stories that there are bridges between daily social actions and social structures on a bigger scale, which means the stories are describing the world as it understood by the storyteller. And talking about stories, I would say some words about narrative approach, which was developed by Michael White and David Epstein. And it's important to mention that Michael White was a social worker and that he was very influenced by postmodernist ideas in fact, by the philosophy of Michel Foucault. And Michael White said that people live their lives through stories, which means if something is happening to me, I would go to someone else to tell him about that, and I will make a story from what happened. And this story can be also only in my head. For example, if something happened, I need to make sense of what happened, and I will make my own story. I will create a story which is not necessarily exactly the reality. And in this sense, there is a very interesting concept in narrative therapy, which is called preferred reality. Why is that important? Because Michael White says the stories we are telling about us are shaping our lives through the real effects they have on us. Because, for example, if I failed an exam and I'm going to someone and I'm saying, look, I failed this exam too, or if I'm thinking it for myself, oh, I failed this exam as well. I might get a sense of being a failure, which is already a matter of identity. Because I'm creating a context like a problematic, saturated story. What narrative approach uses is that preferred reality, which can bring the person to what they call preferred identity. For example, I can say about that the same exam I failed, that, okay, I failed that exam, but I have also another successful event in my life. So this is not going to define me. So I'm not a failure. I prefer another identity than the one of a failure. And it's interesting to look for these ideas in working area, in the professional area, because many professions involves practical training. And when we are doing practical training as students, we are doing things, we are conducting things, or we are doing things, and we have feedback, usually from our teachers. For example, if I would be a student in constructing furniture, I might do a desk, and my teacher would say, no, it's not good because look, it is not stable, it is not, or something like that. So I will have this feedback or feedback from my colleagues, and I will see for myself that it's not good, and I will make a story about it. But it's a little bit special when we are talking about the medical field, because it's not only a feedback from the teacher we are talking about. It's also, there are also feedbacks from nurses, from doctors, which are also important. But there is one, I think it might be the most important feedback for the students, and that feedback is from the patients. Because the patient is alive, and he can tell me that what I did to him was hurting him. So I might make a story with this information he is telling me. And I have some stories from my students, and there are some stories of from their preferred reality, because they were validated by their patients. One of the stories comes from a student in nursing in the first year of studies, and she said something like that. I don't know what I would like to say more, because I have tears in my eyes, especially when I remember that lady. And yes, these are tears of joy, of happiness, because I have never heard, she was the first one to tell me these things. And it was something like, I said, me? You mean me? Are you talking to me? Are you really telling me these things? Yes, it was touching, very touching. She was talking about a patient who was out of the hospital, and she told her very nice things about the way she treated her in the hospital. And as you can see, I'm sorry I cannot bring her voice to hear the way he said that, because he was really thrilled about it. It was for the first time when a patient gave her this kind of feedback, and it was like a very good reaction. And another story comes from another student in the first year of studies, another student. And I really found my satisfaction from the practical training. Yes, you see, it's not a big deal with one of my patients, but I really liked it. And to say more about it, a patient, after she was, well, I helped her with her treatment. It was like not a big deal. However, she stops me on the hallway. She takes my hand, sitting on her chair, and she tells me, "Thank you so much, nurse." I looked around and I said, "No, I'm not a nurse. I'm a student nurse." But she was really talking to me. She was talking about me. So, wow, so I can do good. I can help. I can satisfy people. It was such a feeling. We all know that the social role is considered as a set of expectations that prescribes behaviors evaluated by others as appropriate, and based on success in meeting these requirements, the person is validated as a holder of that role or not. It's obvious that for the students with the stories I presented you, it was about being validated as nurses. But sometimes it's not like that. Being validated as a nurse is very important for them because they can build up their preferred realities, which will act on their sense of nurse identity. And when they are validated, especially when they are making for the first time a technique, or they are doing for the first time something in the field, when they work with a patient, that could lead to positive self-assessment, accompanied by increased self-esteem, or if not, symptoms of distress. I have some examples of self-assessment from a student, one of the students I presented before. Sometimes when I was administrating the medicines, or for example, if I had 2-3 syringes for a patient and I had to spend a lot of time there, sometimes my hand was starting to shake and I was saying to myself, "Not now. Now you have to do well. Now you need to trust yourself and resist." The other patients, because I asked her what was important there, and she said the other patients because they were there. And for example, if, I don't know, I made a mistake and they would have seen some blood or something like that, they would have said something like, her hand was shaking, or she didn't do well, or I don't know what. So she was very preoccupied because it was not a story she lived in reality. It was a story in her mind, but still it influenced her so much because she was so stressed not to make any mistake because the others would have seen her. And when the others are seeing you making a mistake, they can tell you that you are not good at what you are doing. So this would be a story which is not preferred. That would be a not preferred reality. On the contrary, it would be a story they don't like, and it would link to a sense of identity they are not enjoying. So it seems like they need good stories, and they pick up them from the clinical practice. And I will end my presentation with another story from another student, this time in the second year of studies in nursing. Last days, I made an intramuscular injection, my first one, by the way, even if I'm in the second year of studies. Only now I managed to do this kind of injection. And the patient, it was a male, said he didn't feel anything and that I have a good hand. Means in Romanian, easy hand, which it means it doesn't hurt. And after some days, I tested him for an antibiotic. I made him an intradermic injection with ceftamil to see if he is allergic to ceftamil. And the same, when I went to give him this injection, the initial plan was that another colleague of mine should have given him that injection. But when the patient saw her, he asked for me. And I was surprised and looking at him because I didn't understand exactly what he meant. I was not paying attention to him. And then I realized that he was asking me to give him the medicine. And I was so surprised. I didn't expect to have such a good hand in making injection. So this story underlies the importance of the feedback from the patient and for her sense of making injection, which is something associated with the role of being a nurse. So coming back to what Michael White said, that stories shape people's lives, we can see that the story of the first medical maneuver performed by the student can become a part of his preferred reality when his role is validated, and they tend to keep that with them, or a problematic reality if the role was invalidated. Professional life is also shaped by preferred stories sometimes, and by stories creating a problematic reality some other times. And these stories are coming from interaction with the others and with the self, in the sense of the meaning they are giving to the stories they are constructing about themselves, or the meaning of the stories they are getting from the other ones. So I hope you enjoyed my presentation. Thank you for your attention.